So this video is going to be covering tourniquet application of the three types of tourniquets that we use in the department: the SAM XT, the Soft T Wide, and the CAT tourniquet, as well as tourniquet conversion and tourniquet replacement. When applying the SAM XT or any of the tourniquets, you want to make sure that there's nothing underneath the tourniquet, nothing in the pockets or anything like that. When you're applying it, feeding the buckle back through, specifically with the SAM XT, you want to pull in line with the buckle, engaging the snap. You should hear an audible snap or click. When you do, that's your go ahead and feed the tourniquet around the rest of the way. Tighten the windlass. When the bleeding stops, or you can't turn the windlass any longer or anymore, then it's tight enough. Go ahead and drop the windlass into the U-channel and cover it with the gray tab. So for application of the Soft T Wide, when you loop it around, locking the buckle back in place, it's difficult to get all the slack out. The trick to do that is going to be to grab the windlass with one hand and the loose end with the other, pulling as tight as you can. Once that's done, you're going to turn your windlass until the bleeding stops or until you can't turn it any longer. At that point, you're going to drop it into what looks like a small U-channel, and that's the guide to help hold it in place while you pull the triangle up over the windlass to secure it. So when applying the CAT tourniquet, as you wrap it around, feeding the loose end through the buckle, pro tip for the CAT tourniquet is to take your thumb and press it hard onto the buckle into the skin, holding it in place while you pull all of your slack out. Once that's done, you're going to start turning your windlass. Again, just like the other tourniquets, turning the windlass until the bleeding stops or until you can't turn the windlass any longer. At that point, you're going to drop the windlass into the U-channel and cover the U-channel with the gray tab. If you do have any tail left over on this, because if it's an upper extremity, then that tail is going to be fed through the U-channel prior to covering it with the gray strap. So for the SAM XT, I'm going to wrap the tourniquet around, feed the loose end back through the buckle. You want to pull in line with the buckle, hearing for an audible click. When you hear that audible click, feed the rest of it, the tail around, tightening your windlass down until the bleeding stops or you can't turn the windlass any longer. At that point, drop your windlass into the U-channel. Any excess tail you have, run it back through that U-channel as well, and then cover both the windlass and the tail with the gray tab. So for a tourniquet replacement, we're going to be replacing a high and tight tourniquet that's already in place with bleeding stopped with one that's more traditionally located 2 to 3 inches above the injury site. When we do this, we want to make sure that that the patient meets a couple of criteria. One, the tourniquet that we're replacing has to be on for less than 6 hours, and the patient has to be hemodynamically stable or not in shock. The process for this is the same as applying the tourniquet normally. Once the new tourniquet's in place closer to the injury site, the second tourniquet, you start to loosen it, observing the wound for any excess bleeding. If bleeding starts, simply stop, tighten the old tourniquet, and keep it in place and remove the old one. For wound packing, we want to make sure we do a couple of things. One, we're going to do a quick feel inside the wound to make sure that there are no bone spurs, splinters, or shrapnel that's in there that's going to cause us to cut ourselves while we're doing the wound packing. After that, take our gauze, make a little musket ball, and we're going to push in, and we want to fill all the void space up that we can, starting at the direction of the heart, moving back, making sure we fill every nook and cranny, trying to maintain as much pressure on the site while we're packing it as possible. Once we fill all the void space up, we want to take any excess gauze and pack at least a ½ inch of gauze on top of the wound site. At that point, hold pressure for a minute. Applying the Elias bandage as a pressure bandage, you're going to take and put the pressure cup directly over the injury site. That's the clear cup. Hold that in place, wrap tightly around, and as you pull tight each time you wrap around, the Velcro should catch on itself, capturing all the progress that you've got. Wrap completely around the wound, stretching as tight as you can all the way around. Each time you pull, make sure you're pulling tension, and secure the alligator clips into either side once you come to the end of the bandage. Tourniquet conversion is done when you have a tourniquet in place and the wound would be better cared for with a pressure bandage, as long as the follow criteria are met. The patient has to have the tourniquet that you're removing has to be on less than 6 hours, and they have to be hemodynamically stable. Once the pressure bandage is in place, slowly release the tourniquet. As long as no bleeding is observed, you can go ahead and completely remove the tourniquet.